The Nigeria Center for Disease Control, NCDC, has called on private laboratories in Nigeria to support the country's testing on the novel coronavirus. The NCDC Director General, Dr. Chikwe Ihekweazu, made the call at the Presidential Task Force (PTF) on COVID-19 national briefing in Abuja. Ihekweazu lamented that Nigeria, unlike other countries, placed more burden on public laboratories. He said a framework had been developed for private sector participation and promised to send a team of supporters for activation of any private laboratory in any part of the country.
So between January 2020 and 2021, we have activated in total 112 labs with the capacity to test for COVID in Nigeria, 112 so far. Of these 112, 74 are public sector labs, owned and fully funded by various arms of government, while 38 are in the private sector. 33 are completely private sector labs, while the others are kind of part of corporate labs, such as NNLG, Total, all have supported labs that are also serving the population communities around them. Unfortunately, we have not fully optimized the capacity we have in our private sector yet. Several countries have also devolved testing to the private sector largely. If you look at South Africa, 60% of all the tests done right now, done all together since the beginning of the outbreak in South Africa, are done by private sector labs. So we have to push a little bit harder. In Nigeria, 30% of our over 1 million tests have been done in the private sector. The public sector obviously still bears the burden of testing. We've started the rollout specifically in hospitals today. In 5 tertiary hospitals are being consulted with in FCT today. The 3 federal establishments and 2 state tertiary hospitals, Maitama and Asokoro. Our goal is to roll this out to all tertiary hospitals in Nigeria from February. But these guidelines are not just for our procurement. We're also encouraging state governments, the private sector, whoever wants to deploy them. These guidelines are now available on our website. It gives you in detail, a lot of details on what RDT tests to procure, the process for testing, how you need to set up the infection prevention and control standards you need to use if you're using it, the minimum personnel involved, the data flow, and critically, we have an algorithm to use in terms of how to interpret the test and how to link back into PCR testing if it's needed. So we think that with the deployment of rapid diagnostic test kits broadly in Nigeria, we will rapidly even further scale the testing in Nigeria and make sure we find as many cases as possible and link them into care.